you, Ambassador, Admiral, distinguished guests. I'm particularly glad to be here in Washington, D.C. today, as precisely 1 year ago we signed the Memorandum of Understanding between Italy and the United States in the field of medical sciences. Let me first mention what has been done within the framework of the Memorandum of Understanding before getting into the specific theme of the conference. The many achievements obtained in 2010 within the framework of the Memorandum indicate that the cooperation between Italy and the United States is very active and productive. Indeed, the Memorandum should be regarded rather than the decision to generate a top-down approach, a process of formalize, systematize, rationalize, and further stimulate the many existing research collaborations between Italy and the United States. So let's see what has been done in concrete. The Memorandum, first of all, is allowed to continue the Italy-United States Fellowship Program instituted in 2005 within the framework of the oncoproteomics collaboration between the Istituto Superiore di Sanità and the George Mason University. This is, I think, a very successful example of synergistic collaboration between basic scientists and clinical investigations conducting truly translational research. Recently, 28 young scientists, 10 of whom are currently in the United States, have benefited from this program, which has already generated several publications on patients. The second point, which I regard particularly importance is on the so-called on Italian researchers working abroad. Often we read in Italian newspapers that there is escape of researchers from Italy to other countries, or loss of brains or something like that. I don't think there is anything of this sort. And everybody who works in science and research knows that mobility is a normal activity and is something which normally happens and should happen in research. What is probably abnormal is the rigidity of the Italian system as far as public the relations of public employees are concerned. But this is another matter. We, instead of doing what other government has done, and I want to underline that we feel there is no loss of researchers because researchers should move freely. I would like to remember that in the last years there have been over 1.5 million researchers from China and the United States, and probably only a few 100,000 has come back, but certainly China does talk about loss of brains. So I don't think this is certainly an issue. What should be done is not to lose contact with our researchers, with our Italian researchers working abroad. So what we've done was first a survey, and then we are establishing a network. We have invited them, 100 of them already last year in Chernobyl. Next Monday, this Monday, the coming Monday, there will be the second meeting in Chernobyl with myself and Minister Germini, inviting all foreign researchers, Italian researchers working abroad, with the aim of constituting a network. Not only that, but we have used them, and we have asked them to serve as a panelist in the study section, which should judge the research application for the main Italian program, which has been renewed of 100 million euro for translational research of the ministry, which has been sent to referees all over the world with the help of NIH. Then the referees, the replies come back, and obviously sometimes you have to, when you don't have all the replies or the replies are not the same, you have to make a choice. The problem is that we wanted to have independent advisors. So these researchers who sometimes complain for the fact that they couldn't find space in Italy because lobbies have not allowed them to come back in Italy are judging all the work of the lobby itself. So I think this is a good idea. It's been a successful operation, and that I think should be put under the framework of the memorandum itself. Another issue is regarding more specifically the memorandum, what is activity in oncology. More than 50 Italian researchers have been in the United States in 2010 within this framework, and more than 50 joint projects between Italy and NIH on in oncology, cancer research in biology, epidemiology, prevention and treatment. And all this has been discussed yesterday, thanks to the ambassador with the Secretary of State, Kathleen Sebelius, and more other issues have been discussed, such as the campaign against smoking, which has been launched by Minister Sebelius himself in the recent conference at New York on the non-transmissible disease. There is Global Smoke-Free Worksite Pledge and the text library, which entails messages, SMS, phone messages on anti-smoke strategies. We have discussed strategies for nuclear radiological events. We have in Ospedale Spallanzani in Rome a very degree 4 level for radiological, biological, radiological, bacteriological risks, which is practically unique in the work, and we have put at the disposal of cooperations even of the United States and France. And finally, again, in the field of oncology, we had a discussion on personalized treatment and of the problem of innovative drugs which tend to go out of control and how these can be controlled. We are thinking of strategies such as cost sharing, payment by results, registries, and the study of markers to improve the specificity of targeted drugs to different kinds of tumors. So this is aside from what is already an understanding, and we will ask the embassy to act as a trade union and to establish for all these points, including obesity, which is part of the issue, bilateral technical groups to go more deeply into this matter. And finally, the present symposium is among the activities organized in the framework of the Memorandum of Understanding, and thus I have to thank Ambassador Terzi twice. First, for having organized the symposium, and secondly, for having chosen the theme of obesity, which is particularly timely. The fact that obesity is an important emerging threat was recently brought to attention of world leaders of the United Nations at the high-level meeting on the prevention and control of non-communicable disease, which was held in New York last September. We know that obesity damages almost every organ system in the body, is a major risk factor for cardiovascular disease, for musculoskeletal disorders, for cancer, and for metabolic disease such as diabetes. Obesity seems to be even more than a risk factor, and we know today that the association of obesity and type 2 diabetes is so frequent that has given birth to a new nosological entity called diabesity. Because the association is very, very strong indeed. But the real problem in Italy is not adult obesity, where we are below OX levels, but is childhood obesity. In fact, adults tend not to be obese in Italy. Somebody attributes that to the Mediterranean diet, that this is possible. But recently, we had, and the reasons are quite clear, an increase of childhood obesity. Now, the data are that among children between 6 and 17 years old, 23 are overweight and 12 are obese, which makes 35 either overweight or obese, and that is worrying. And even more worrying is the distribution into the different Italian regions. We have 23% in Val d'Aosta, where they probably can go freely in the mountains, and same in Trentino and Adige, whereas we are up to 49%, that is the mixture between overweight and obese in Campania. Now, what are the reasons of that? Now, these raising levels of childhood obesity are due, A, to the dietary intake of energy-dense foods, which are high in fat and sugar, and low in other nutrients. And secondly, a trend towards a decreased level of physical activity. So this junk food and low physical activity. We know that 38% of children, Italian children, watch TV or play video games for 3 or more hours a day. And most Italian children don't do enough physical activity. So what can we do? In general, and that is a general recommendation which should apply even to this meeting, OXE recommends a multi-stakeholder approach where governments handle directly prevention measures, but at the same time encourage the involvement of the private sector. And indeed, we recently launched in Italy the National Platform on Food, Physical Activity and Tobacco Control, with representatives of central and regional governments, including the Ministry of Health, Agriculture, Ministry of Education, regional authorities, food industries, consumers associations and unions. The main primary prevention program run by the government in Italy, its director Oleari is here, is called Guadagnare Salute, which means gain health, and is addressed to general population. We have a prevention program which is divided into primary, secondary, and tertiary prevention. Primary to the general population, secondary prevention is to categories at risk, and tertiary prevention to prevent chronic disease patients who have realization of their disease. So the Guadagnare Salute has got 4 basic guidelines, which are healthy food, physical activity, combating smoke, combating alcohol. And to encourage healthy food habits, the program includes information campaigns and curricular education on healthy food in primary schools. But also guidelines to canteens and cafeterias, food policies, particularly in school cafeterias. We have issued a special ristorazione scolastica and special guidelines to school cafeterias food policies. Agreements have also been signed between the Ministry of Health and the Association of Pediatricians. And now that's the Guadagnare Salute for food. Then we have Guadagnare Salute for physical activity. We develop projects to promote physical activity in Italian schools. But I think to this respect that more work has to be done in our country. And at present we feel we are behind other countries in physical activity done in school, and we think we should build more sport fields and infrastructures on public school. Another important area which is outside the Guadagnare Salute and is done within the framework of the in Europe, European Community, the Ministry of Health has recently devoted myself and the structure a lot of effort in the area of food labeling. Food labeling is handled by the EEC, so it's something which is object of EEC resolutions and laws, and we have contributed to a recent approval by the European Union of the rules and guidelines on food labels, including stringent claims on food health, aimed specifically to control energy-dense foods consumed by youngsters. So this is something which goes exactly in this direction by controlling which are the so-called claims on health on one hand, and even the size of the products which has to be written on the labels. Finally, Ambassador Terzi mentioned the issue for safety and nutrition will be the leitmotif of Expo 2015 in Milan, dedicated to feed the planet energy or life. And I would like to underline that in our country, Italy is one of the few countries where food safety is handled by the Ministry of Health rather than the Ministry of Agriculture. And that helps to a certain extent in these initiatives. So for all these reasons, ladies and gentlemen, The issues debated at this Global Health Forum are particularly important. I think you can have guessed from my words how a lot of work has been done in this direction and how a lot of work should be done. And for this I want to thank again Ambassador Giulio Terzi di Sant'Agata and his staff for having organized it, and I wish you a very good meeting.